How do you know when to go to the hospital when you are in labor? I'm here to tell you that you do not want to get there too early because being in early labor at the hospital, not fun. And you also don't want to get there too late because you don't want to be delivering your baby in the car. Although I have a whole video about that I'll link down below. But today I want to give you some things that people don't seem to talk about. Timing, when you go, when you're in labor to the hospital. I'm glad that you guys are here. And if you're thinking about this, you're thinking, what else do I need to know about? I actually have a whole third trimester prep pack that I'm going to link to down below. It's going to be super helpful. You guys are going to love it. Now, stay tuned because we're going to talk a little bit more about like why you want to be there at a specific time. But first, I want to talk about these things that a lot of people don't talk about. And I feel like, first off, that everybody sort of feels like we just live next door to a hospital. But the more I talk to people on social media, many of you are driving up to an hour plus to get to the hospital, which makes it extremely tricky. And in those cases, I could totally see getting a hotel room to just kind of labor in if that's in your budget, which it just makes it hard. So if you live far away, this is a discussion you want to have early on with your providers and see if you can talk to them when you're at home to really make that best choice as to when they come in. I would say that if I'm in a hospital where people are driving long distances to get to us, we're a little bit more amenable to maybe not sending you us home as quickly or things like that, letting you labor a little bit longer in triage to see how things are going. I think hospitals understand when you're driving a long way that it's a little bit different than if you're just around the corner. Now, another one is, what is your previous history? So did you have one that came very quickly? Then you're probably going to want to get to the hospital faster this time. It doesn't always follow what your first baby did, but it's really our best indicator of how quickly things are going to go for you. So if you had a very quick labor last time, definitely going to want to have that conversation with your provider about how soon you should be going into labor and delivery. And I'm here to say that if you go into labor just to make sure that everything's okay, that the baby is not imminently coming, that's okay. As a labor and delivery triage nurse, that's one of our big jobs, to make sure that you and baby are safe. And if you're in a good position to either stay in the hospital or to go home. So if you feel like you go to the hospital and they send you home, please don't be embarrassed about that. You've gone to the hospital, you made sure that you and baby are safe, and hopefully they'll give you some ideas of what you should be expecting to bring you back in when you're in real active labor. And I keep saying real labor, but early labor can feel very painful. And so, when you go to the hospital, they should give you some other indicators to watch for as well. The next one is your GBS status, group beta strep. In the United States, we check everybody for that at about 36 weeks of pregnancy. If it is positive, we want to have at least 4 hours of that going in your IV before the baby comes. So talk with your provider about that. I know there's some people online who say that you can just have a douche or take oral antibiotics, but that is not the case. It is created to literally just like take away all that bad bacteria in the birth canal. And then, after the 4 hours, it can rebuild it back up. So that's something to think about as well, though. You're not wanting to get there right at delivery if you are GBS positive. You're going to want that time to let the antibiotic infuse. The next one, and as we get these giant hospital conglomerates, is parking. Some of these, even the expectant parent parking, is far, far away. Now, most of the big hospitals have valet parking or at least where your partner can pull up to the hospital, get you up to labor and delivery, and then go repark their car. But sometimes also that door is a long way from labor and delivery. So I think it's important to know kind of how the hospital works, where you're going to be parking, how far you're going to have to go before you reach the labor and delivery unit. Now, in most of these cases, we're not talking more than 15 minutes, but that can make a pretty big difference when you're a labor. 15 minutes doesn't feel great. This is part of the reason that I encourage everyone to go on a hospital tour. I think it really helps you to know the hospital and where you're going and all those different things. Plus, you can get tons of questions like this answered, including what we're going to talk about next, which is traffic. So I worked at a hospital that was next to a major mall in the area. And on weekends, especially around Christmas, people needed to add like a half hour plus to their labor and delivery drive because it would get so crowded around where we were. So talk with your provider. They are very well versed on the traffic around your hospital, anything you should be looking for, any time of day that is worse around the hospital than others. I'm sure people that have babies in major metropolitan areas also understand this. But Our hospital was very easy to get to in the mornings, but if you went to us at a Saturday at 2 p.m., it suddenly was a whole different beast. So that's something to think about as well. And something as we go into the next section that's important to know is the different stages and phases of labor. I'm going to actually link a video I made all about those down below. But when do you want to get to the hospital? As labor and delivery nurses, in general, we're really aiming for you to get to the hospital when you get into active labor, which is about 4 to 6 centimeters. But it really is that your cervix is actively dilating, which means that if I check your cervix right now, which is just the bottom of your uterus, and then I check it again in an hour, it has changed. That shows us that the cervix is actively dilating and your labor is progressing. In early labor, it may have softened a little bit. It might feel just a little bit different, but it doesn't feel enough that it's really changed. And so at that point in time, it's better to go home. You're in a safer environment to actually go home. Now, why is that the case? I'm here to tell you that the hospital is very safe. We take people in early labor. We have inductions where people are in early labor, but in early labor, when you come into the hospital, it just kind of stifles a lot of those feel-good hormones that you might be having going on. And in fact, the feel-good hormones of oxytocin is something that I learned about later on in life. It's one of the lies about labor. I'm going to link it down below. But we can interrupt those early patterns by things that we do in the hospital. Us asking you 16,000 million questions. We 100% know and understand us. Us checking your cervix if you find that uncomfortable. That can shut off the oxytocin and you might not feel as safe as you would otherwise. The lights on in the room, us putting in the IV. When you're going into labor, you got to think that your brain, the baby, and your uterus are all agreeing. And a lot of times the things that we do in the hospital sometimes make your brain feel a little bit less safe. And so it can shut off those early labor tendencies, which is why it's better to do those early labor things at home. Plus at home, you have your food, your people, your smells, your things. You just feel so much more comfortable than in the hospital versus when you go to the hospital, you're going to want us to monitor the baby, which sometimes means you have to be in a certain position and things like that. But of course, if you ever have a question, you can come into labor and delivery and have us check you out, make sure that you and baby are safe. And then you and your provider team can decide where is the best place for you. Now, I'm here to tell you that early labor at home can feel a little bit scary. If you're here at the pregnancy nurse where we get you prepared, not scared for hospital birth, you're planning on the hospital managing your labor. You're thinking, when I start having contractions, I'm going to go to the hospital. But the hospital might not be the best place for you when you're having these irregular, less painful contractions. It might be better to do it at home. I got to tell you, my husband was not good at this, which is why when I created the online prenatal class for couples, I really gave partners tips on things they could do, things you could eat, and positioning that you can use to help labor progress or to help mom get some rest, which are both great things to do in early labor. Again, I'm going to link that class down below. So how do you know when to go in? The rule of thumb is 3 to 5 minutes apart, 5 if it's your second plus baby, 3 if it's your first baby-ish. And you can't talk through the contractions. For me, I often had very 3-minute contractions, but I could talk through them. And so is that a time to go to the hospital or not? As those prolonged, I would usually call my provider and say, hey, what do you think? And I got to tell you, as a seasoned provider, usually, especially if they already know you on the phone, they can kind of tell if it's a time that you should head into the hospital or not. And again, you can always head into labor and delivery and don't feel bad if they send you home because home is going to be the best place for you at that time. Now, when you arrive at the hospital is one of the big keys to a great labor, but I actually have other keys to a great labor that I'm going to link to up above. Thanks for joining us here on the Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.